Good evening, everyone. Welcome to another session of Gut Over It. My name is Dr. Vivian Asamoah. I'm a gastroenterologist in Katy, Texas. I want to start by just, wishing that you guys are all doing well, that you're all safe and sound at home. You're out of the streets and warm. For those of you guys who don't have light or like have power or heat, um, my heart is near you guys. My heart is warming you guys at home. And I hope this all gets soon, a lot, like soon, very soon. We want it to get better very, very soon. So hang in there. It is going to get better. I think tomorrow is going to be brighter. The sun's going to be out. It's going to be a better day. So hang in there, okay? I know a lot of you guys don't have internet, you don't have power, you're not able to see this. So if you're watching tonight, thank you so much for joining me. And if you're listening to this on the replay, remember that day that it snowed in Houston. So I was saying that I was going to do these gut over its rain or shine. And today I kind of questioned myself and I say, did I say sleet or snow? Does that factor in there? Should I get a day off? And I said, you know what? Let me just do this anyway and share some educational information. The whole point of Gut Over It is basically, as a gastroenterologist here in Katy, Texas, I've been in practice for over 10, 12 years now. I wanted to be able to provide some entertainment and education to patients and just people out there who maybe have gastroenterological symptoms and may have questions for their doctor or not know how to ask or what is relevant to share. And so I set myself on this February challenge, this month challenge, to discuss a GI topic every night in the whole month of February. And today is February 15th. So I am definitely 15 days in, and it's been going great. And I'd love for this to segue into a private Facebook group that I'm putting together. And I really want this group to be focused on people with chronic gastroenterological symptoms who've tried conventional medicine, diagnostic testing and treatments, and are ready to try something different, to go a more integrative functional medicine, holistic route to basically heal and have a better relationship with food. So I think that's my mission as a gastroenterologist, sort of after having really looked in depth at what conventional medicine has to offer, really bringing in that integrative component. So I'll be launching our Facebook group very soon. It's going to be a private Facebook group. It's going to be filled, jam-packed with a lot of information, resources, great videos. I want to do some great interviews with mentors that I've worked with over the years, inspirational functional medicine providers. So it's really going to be geared towards integrative functional gastroenterology. And the name of the Facebook group is called Natural Gut Relief, and we're kind of putting everything together. And if you guys enjoy these series, I think that the Natural Gut Relief Facebook forum will be a lot more personalized, a lot more in depth, with a lot of research. And I want patients to also come and share their testimonials. So look out for that. I think it's going to be great. So tonight, I wanted to pick a topic that I love, and I love the liver. And I wanted to pick something that was common to most, that everyone kind of had heard about, or maybe your doctor had actually told you that you had fatty liver. And so as a gastroenterologist and liver specialist, I get a lot of referrals from primary care doctors about fatty liver. And the question is, why does this matter? Who cares if there's fatty liver? Usually, how do they detect it? It could be seen a slight bump in liver enzymes, or you just get an ultrasound for some other reason and we detect a fatty liver. How important is this? What does this mean? Is this really relevant? And that's a great question, because a lot of times when patients come to me, they're just wondering what they need to do. Most of the time they hear from their doctor that you got to lose weight, which is true. But let's talk about the nitty gritty of fatty liver a little bit and talk about why it's so important. So when it comes to liver disease, the most common one we know is alcohol-related liver disease, right? And so another term for fatty liver is non-alcoholic fatty liver disease, because alcohol can actually lead to fat in the liver, but so can sugar, triglycerides, other issues. And we're seeing more and more of fatty liver from non-alcoholic causes, or sometimes from joint causes, right? The combination of alcohol and non-alcohol, as a cause of scarring in the liver, cirrhosis in the liver, and patients needing liver transplants. So the studies are showing in major transplant centers that the number one cause of someone requiring a liver transplant, is actually very soon going to be fatty liver, cirrhosis of the liver from fatty liver, not hepatitis B, not hepatitis C, because we have treatment for hepatitis B and C, almost pretty much curative. But fatty liver is a growing epidemic, along with the growing epidemic of obesity in the United States of America. So this is an important topic for primary care doctors and for hepatologists as well. And so I'm going to talk a little bit about why fatty liver. And if anyone has any questions, as always, feel free to ask. I have some prepared questions because I know that some of this will actually come up. So who gets fatty liver? And actually, let's talk about, who gets fatty liver? So we usually will see it in anyone. Anyone can get fatty liver. We're seeing it in children. We're seeing it in adolescents. We're seeing it in preteens, 14, 15, 16 years old. We see it in adults. We see it in older people. We also see it in people who have a personal history of high blood pressure, insulin resistance, cholesterol problems, people with what we call metabolic syndrome. We see it in women with polycystic ovarian syndrome, because this too is an issue with insulin resistance. So we can see it in anyone, and we're seeing it start very, very early in young children. And this is concerning because the fat in the liver actually causes inflammation, and this goes to form scarring in the liver, and that's what forms cirrhosis, right? And we believe that we have about 20 years for this whole process to happen. So if I'm seeing, if we're seeing a young person at the age of 14 with fatty liver, by the time they're 34, they have cirrhosis. And we are seeing this as adult gastroenterologists in practice. So it's an extremely important topic. It's extremely important. And I think that fatty liver is going to probably be the number one a cause of mortality of young people in the future, along with cancer. We'll talk about why. So what happens, how is it just that the liver, accumulates all this fat? Because the liver is sort of the hub, is sort of the factory for processing cholesterol, right? Triglycerides is a kind of lipid, it's a kind of fat. And when you eat a lot of sugar, a lot of processed, refined white foods, bread, pastry, bleached flour, all of that actually transforms into triglycerides attaching to that sugar. So triglycerides form these fat goblets in the liver, and that gives you that fatty liver appearance. I don't know if any of you guys have had foie gras, which is the very fatty, that delicatessen food, foie gras in France, which is just an animal that's just been beefed up with fat, and they have this fatty liver. It tastes great, but it's a very unhealthy liver because the liver can't actually do its job. So basically, it's because of sugar. It's because of sugar. It's because of refined processed carbohydrates, and that leads to that fat accumulation in the liver, and the liver can't do its job very well. So you develop insulin resistance, right? Prediabetes, cardiovascular disease, right? Because you form plaques in your heart vessels. And this is a problem. It's a big problem. Again, it can occur at any age in anyone, but there is a population that is extremely high risk for fatty liver. We see in about 100% of people who have fatty liver, 22 to 45% of them are Hispanic. So there's a genetic component there, which means these young Hispanic patients who are developing fatty liver will go on very, very early on to develop cirrhosis of the liver, which is deadly. Cirrhosis of the liver from alcohol and cirrhosis of the liver from fatty liver does the same thing. It causes the same complications, the same need for transplant, the risk of liver cancer. So it's equally as bad. So my Hispanic people out there, if your doctor has noted elevated liver enzymes, a fatty liver on imaging like an ultrasound, please listen to this live video. Please listen to this. Ask your doctor more questions about what you can do to prevent it, okay? What you can do to prevent it. So I want to talk, because it can lead to future complications at a very young age. I want to be a little bit more specific about the types of foods that will cause fatty liver. We know specifically high fructose corn syrup. That has been associated almost at 100% with causing fatty liver. High fructose corn syrup, if you open your fridge, it's in everything. It's in ketchup, it's in seasonings, it's in sauces for salads, it's in everything. So high fructose, it's in soda. It's a lot of that is what's in soda. So, and that's why we're seeing it in young children, right, who are drinking soda. So high fructose corn syrup is one of the number one causes of fatty liver disease. And people just not eating enough fruits and vegetables generally. So that's another major issue, right? How do you prevent it? How do you reverse it when it actually does happen? Your diet, it's a diet and lifestyle thing. And quite surprisingly, at this point in time, medicine has not developed a treatment for fatty liver disease. The only treatment for fatty liver disease is changing diet and lifestyle. So this shows how important diet and lifestyle is. Imagine if you don't change your diet and lifestyle, it will go on to fibrosis, inflammation, fibrosis, cirrhosis, liver cancer, needing transplant. If you do a 360 and change your diet and lifestyle, this fatty liver and its complications is completely reversible, right? There again, going to root cause analysis and making sure that lifestyle and nutrition is incorporated into every doctor's visit, right? So when you see your hepatologist or your gastroenterologist like myself, and we are told that you have elevated liver enzymes, right? Or fatty liver on ultrasound. What do? We have to take a detailed history and make sure this isn't liver disease caused by anything else, right? We can't assume it's fatty liver because you're a little overweight. And not everyone with fatty liver is overweight. So we have to rule out things like viral hepatitis. We have to rule out autoimmune hepatitis. So your doctor still has to do a workup. What we don't want is for your doctor just to keep noticing the elevated liver enzymes over years and not doing anything about it. That can become dangerous because you may be having inflammation, but until we actually try and put a halt to it to reverse it, this gets worse. So we're going to talk about some natural remedies to help restore the liver, okay? And so detailed workup must be done. Avoid any medications that could be hurting your liver even more. So if you're using a lot of Tylenol, a lot of Motrin, Aleve, if you're drinking a lot of alcohol, once you have fatty liver on top of that, you have to cease anything that we would say is hepatotoxic to the liver. Okay, so you have to make sure you rule out all of those things. Now, this is a tricky diagnosis for gastroenterologists because people may have fatty liver and actually have quite advanced liver disease with normal liver enzymes. So you may actually do an ultrasound and we see fatty liver, but you look at the liver enzymes and it's totally normal. That's actually worrisome. So a good gastroenterologist or hepatologist knows to dig a little bit deeper because you want to see what is the patient's risk factors? Do they have high blood pressure? Do they have prediabetes? Do they have cholesterol issues? You want to tackle all those issues. Do they have PCOS? But you also want to go and assess, well, does my patient right now already have signs of fibrosis? Do they already have cirrhosis? And there's no way you can make a diagnosis of cirrhosis just based on an ultrasound or CT. You need additional blood test. You need specific kinds of imaging. There's one called a fibroscan. That's an ultrasound fibroscan that actually measures the elasticity of the liver. You may need a liver biopsy. So when you have that diagnosis of fatty liver, it's really hard for your primary care doctor or gastroenterologist to see how severe it is. Truly it is. I've been amazed by maybe a 40-year-old coming with slightly fatty liver and elevated liver enzymes. And they tell me, you know what, Dr. V, someone first told me I had elevated liver enzymes 10 years ago. Nothing was done, right? No one worked up their blood pressure. No one told them about diet change. And I said, well, let's do our workup. I start doing my detailed workup to first make sure that I haven't missed another kind of liver disease. And then I assess that, you know what, this appears to be fatty liver. And then I do a fibroscan. And on that fibroscan, I see that my patient is already cirrhotic. He's got cirrhosis at age 40 something. Had we made this diagnosis earlier, we would have had the chance to reverse this pathology. So it's really important that you as a patient, you're an advocate for yourself because it's an easy diagnosis to miss and unfortunate to miss it because it's easily reversible. So we're going to talk about lifestyle modifications. And as you know, we're going to start off with weight loss. Absolutely very important. I just want to make sure I have all my notes with me. So I'm giving you guys facts All right. So weight loss is number one. And how do we lose weight? Slowly but surely. Consistency, right? In trying to reduce sugar, cutting back sodas, from your diet, avoiding everything white, right? Lots of fruits and vegetables. The Mediterranean diet, which is full of fruits, plants, vegetables, and nuts, has been shown to be the best diet for fatty liver. We also encourage when patients are starting that journey to perhaps do some intermittent fasting. And if you're interested in anything like that, please reach out to my office and we can share some information. I actually have a great resource on fatty liver. So in terms of the diet, what to eat. And if you're interested, go ahead and just send me a message on the comments and I'll send you a personal message and send that over to you. It's a very, very wonderful resource on what to eat when you have fatty liver. So the diet is extremely important, making sure, and then from a dietary standpoint, avoiding high fructose corn syrup, avoiding alcohol, staying away from red meat, exercise, and that could just be 30 minutes of brisk walking every day. As simple as that will help reduce the weight. Avoid stress eating. So some meditation. If you guys can hear, I've got a little bit of meditation going on today. It's a very calm day for us at the house. So avoiding stress, all right? In terms of supplements, because there are no real great prescription medications to recommend, none of them have been shown to work as well as diet and lifestyle. So in terms of supplements, what I've recommended to my patients is what the research shows. Fiber. So I usually have them add a little psyllium husk, maybe a tablespoon, with 8 ounces of water to every meal, because we know that this does two things. It makes you feel full. It helps with weight loss. It also helps change the gut microbiome, because we know a lot of people with fatty liver disease, their microbiome is off. They all have a little bit of bacterial overgrowth, a little bit of SIBO. So fiber is extremely important. Probiotics is the one thing I've seen in research that really helps reverse this pathology. A lot of people don't know, but probiotics, a world of a difference. I use a lot of omega fish oil that has also been shown to help with the lipid issue, antioxidant, anti-inflammation. I use a supplement called N-acetylcysteine, which is otherwise known as NAC, which produces glutathione, which is a strong antioxidant, so reducing the inflammation and the stress in the liver from the fat inflammation. And I make sure my patients have enough vitamin D. Now, if you look at the labs, they'll say that you need about 30 grams of vitamin D is sufficient. We know that your level should be around 60 to 80 at each blood draw to make sure that you have all the beneficial effects of vitamin D. So we've talked about diet, we've talked about supplements, and there's a couple other supplements that are naturally great for insulin resistance, like reducing berberine. That's a great reducing glucose levels, and that's berberine, a very natural supplement that's really helpful. I want to make sure I haven't missed any questions before I jump off. Again, guys, make sure you ask whatever questions, leave it in the comments. I know a lot of you guys will be listening to this on the replay, so please go ahead. I discussed whether fatty liver was bad. Yes, because it can cause cirrhosis and it can do so in a very sneaky way. So don't ignore fatty liver. Who is at risk? We talked about people who have high blood pressure, diabetes, PCOS. Women with PCOS, please talk to your doctors about it. And of course, the Hispanic population. How do you get rid of it? Exercise, eat great. What types of food to eat? We've talked about it. Stay away from high fructose corn syrup. If you want that resource that I have, please send me a message in the comments. Share this with someone and I'd be happy to email you that resource. And then good things to support the liver. Absolutely. Probiotics, fiber, and I'm talking fiber and diet, but I really want you guys to start taking psyllium husk if you have fatty liver, omega fish oil, making sure you've got enough vitamin D on board. And if you want to learn more about that antioxidant called NAC, send me a message and I can share some more information about it, okay? That's all I got. Fatty liver is an exciting topic. It's great because I think it really brings in that combination of conventional medicine and functional medicine and really focusing on root cause medicine to prevent future complications and disease that are highly, highly preventable. I love liver disease. Well, I don't love it, but I love learning about liver disease. I love treating patients with liver disease. And I think I've done a lot of research and really understand the nuances about it. So I'm here and happy to help Again, my name is Dr. Vivian Asamoah. I am a gastroenterologist in Katy, Texas. I'm also a functional medicine provider. My practice is open and accepting new patients. Thanks for joining us again tonight on Gut Over It. Tonight was all about fat shaming the liver and getting rid of fatty liver disease. If you have any questions, please feel free to message me. Again, this is Gut Over It, our February challenge of discussing an exciting GI topic every single evening. You guys be safe out there. Be really safe out there, okay? I know it's going to get better. Hang in there. We're all hanging in there. And hopefully, the rest of this week will be full of sunshine. Have a wonderful day, guys. And thanks for listening in. Bye-bye.